It is 9 days to Christmas, and while the countdown continues, concerns over insecurity and rising cases of COVID-19 top major discourse in the country. There is, however, hope that many lives could be saved with the COVID-19 vaccine made available by Pfizer. Already, the U.S. and the United Kingdom have rolled out vaccines, beginning with the most vulnerable health workers and the elderly. Nigeria is yet to get the vaccine, and there are indications that the country might enter a second lockdown if figures of new infections keep rising at this rate. Well, joining me in the studio is Pascal Achunine of the Health Emergency Initiative. Good morning. And first, let me congratulate you on the recent award from the Future Awards, the just concluded Future Awards. Congratulations.
Thank you.
On what you do. Thank you so much.
Thank you for having me too.
Yes, thank you for coming. Now, the issue are the concerns being raised with regards to the rising number of cases. But then a lot of people believe that with the recent vaccines that have been made, that seems to bring a glimmer of hope for a lot of people. But there are also concerns with what should be expected once people take the vaccines, because there are also reports, controversy also trails those reports about the fact that there are reactions to these vaccines, who should take it, who shouldn't take it. But talk to us what you know about this vaccine and what should be expected when it is taken.
So the vaccine is most effective for prevention.
Right.
So if you have someone who is already in the ICU, there's very little the vaccine can do, because the chances of survival is very, very low. And we also need to dimension it in the context of the vaccine is yet to get to this part of the world. If you look at the US and other locations, and the UK and the Western world, where the vaccine was invented, they're still grappling with COVID-19 challenges. The death rate in the US as at 2 days ago was 300,000. So as much as we saw a communication or a report from the Honorable Minister for Health that Nigeria is ordering for 20 million.
Yes.
There's a timeline between the time the vaccine would be shipped, in fact, approved and sent to us, and when it will get here.
Right.
But we have a crisis right now. You could see the number is very scary. The number of infected people, especially in the last 9 days, it's getting pretty bad. Last week, I recorded over 3,000 infections. And the last time we had that number was sometime in July. Many had gone or moved on with their lives thinking the COVID-19 had come to an end in Nigeria, especially after the NSAS protests and co. People felt that, okay, since there wasn't massive cases, widespread cases, people thought that it was over. But right now, we are hearing of deaths. We are hearing of high-profile persons, even generals.
Yes.
We had the death of a major general last week.
And over 20 of them are said to have the infection.
Been exposed. And some, even the governor of the state is tested positive and is currently on isolation. And we think that is a white man or big man's kind of infection. It doesn't concern us. So the truth is, before I come back to the vaccine, is that what do we do now to make sure that before the vaccine gets here, we are still running as a nation, we are still alive? Do we have proper response program for this increasing number daily? The figure shows 748 as at yesterday, and that's as for the few that have been able to conduct tests. So that may not properly be a reflection.
May not reflect the true picture.
The true picture, because many are not aware that they could still go to the testing centers and access testing free.
Right.
Most of the tests you see conducted, they are essentially relates to those who are traveling in or out. So, but we had a scary figure. But
and there are also those who are asymptomatic. We have to mention.
Yes, many are very asymptomatic, and so and we are going into festive season, as you pointed out in your report. So people have lowered their guards. Everybody has thrown the caution off the wind, and we are in celebration mood. The tragedy is Is there anyone that is enforcing the protocols? Is there anyone, what is those saddled with the responsibility of ensuring compliance, what are they doing? And that is where the danger is, because if this level of infection continues and the community transmission explodes, we don't have capacity. If you check what happened in Switzerland, in Belgium, at the time, the infection was so high that the ICU couldn't handle it. We don't even have 1% of the capacity those people have.
Right.
And we are ignoring this. And the Harmattan season is close by. So that can also worsen the situation.
We are ignoring this. How are we ignoring it? Is it that people have refused to take responsibility, or is it a challenge of the trust deficit? Because the government, the PTF, have been giving briefings and giving information on a regular basis. So what is the missing link that is not allowing people, that is making people ignore this message by the PTF?
You properly captured it. Trust is a scarce commodity. Most people do not trust what comes from the government, especially with some experiences in recent time. And the people too feel that if I die, I die. So many have got so poverty and hardship and several other factors have made people that they don't care anymore. But that is being defeatist. We must wake up as government. Government must wake up to ensure, let's say in Lagos State, for instance, if you cast your mind back, the Minister of Environment deployed some measures to make sure that markets, motor parks, and other facilities comply with certain environmental requirements.
Absolutely.
So there could be an activation of similar measures. Okay, if this is a religious organization and you send maybe Safety Commission, Lagos State Safety Commission, that certifies facilities before they open, or clubs, and they are violating this. You could see what happened to the actors in Uganda. They did not take it for granted.
Musicians, actually.
The musicians, sorry. So what it means is that if those who are saddled with responsibility of enforcing take it very serious, but you see some significant change. But more importantly, engaging the people, and you must identify trusted actors, social sector actors, who can work with you to reinforce and buttress your message. And very importantly, it's also very critical to ensure that as the media and even the government must intentionally run something like
advocacy.
Besides the periodic occasions, you call people's attention to the protocols.
Yes.
You can run something like documentaries. X number of people died. Former president of Ghana died recently because of COVID-19. So there will be such enlightenment program that goes beyond the way we've been saying, okay, don't wash your hand, use your nose mask and all that. I am certain that if there's a collaboration, even Kakovic getting involved in the process, I will see significant change. Otherwise, this will potentially be a serious danger. As
it is right now, with the rising cases, we will still get back to the vaccine.
True.
Yeah. As with the rising number of cases that we are witnessing, do you think we can afford a lockdown? Bearing in mind the impact it had on the economy the first time.
I will clearly say that there was a better country as at the time there was a lockdown than now. We have increased insecurity. Hunger is higher. There was better trust people had for the government then. I'm seriously inclined to think that if you say a lockdown will have more negative and catastrophic effects, it will better be to engage non-state actors who work with the state to ensure that the public comes to the consciousness that this is the risk you stand to in the event that this gets to you. Even if you're a trader, let me put it this way, if you're a trader and you have COVID-19, for 1 to 2 weeks, you will not be in your business. If you like enjoyment, let me use the word enjoyment.
Because the festive period.
Yes, if you get infected and you die, you will not see another Christmas. So why not conduct yourself, use your nose mask, apply all those social distancing and other protocols, and be alive until this whole thing blows over.
Now, let's get back to the issue of the vaccine,
Yes.
which you were talking about earlier on. And you said it is more for prevention. It is not to treat those who have been infected.
Especially those who are in critical states in ICU. So the vaccine, typically, vaccine is meant to be a preventative act. It's not a cure.
Right.
Yeah, so the essence is to ensure that those who have not, especially those who have not shown serious signs, like those who are asymptomatic, if you use it, it will work for them. Those who have not been exposed at all to to COVID-19, it would prevent over 90% chances of not being infected, especially from the Pfizer, the one from Pfizer and also from Moderna.
Yes.
94%. So if a vaccine has 94, 95% respectively capacity of prevention, that is great. But if you have been infected or you're already in critical condition, it will do little or no good to you.
Right.
So we are not expecting it from the conversation that Dr. Ngozi Okonjo-Iweala and some others have shared. We are not expecting that the vaccine will be here earlier than the middle of first quarter of next year.
Well, because some other countries, that is the first world countries, are still trying to get their own supply of even this vaccine. So
True.
before it gets to Africa, it might take a longer time.
Yes.
And that is why it is essential for people to take precaution.
True. And even when it gets to Africa, what methodology has been deployed to ensure that it trickles down, not that a few persons, maybe the elites or those who have access to state resources will be the only ones. Because the tragedy about this infection is that you could take the vaccine as yourself and your immediate family, but your house help could get infected while
so it doesn't protect you from infection, even after.
No, it does.
It.
But I mean, what I'm saying is that there is still a risk.
Right.
After all, there's still, if you look at it, it's 95%. So there could still be a chance that you might. And there's a limit to what, I mean, COVID-19 showed that science also has certain limitations.
Right.
So let's be large-hearted, let's be charitable. Let's ensure that we are not selfish in the way and manner we relate to this dispensation.
What we see the US and the UK doing is that there are certain categories of persons that are receiving, are the first people who are receiving the vaccine. Frontline
health workers and the elderly who are more vulnerable.
The vulnerable.
Yes.
If we are to have that, are you saying we should adopt the same strategy?
Excellent, because it's the health workers that will ensure that even those who are infected would be treated. So the health workers need to be protected, and that will reinforce their confidence to attend to cases. And then the vulnerable, because typically those who have pre-existing medical condition or those who are vulnerable, the elderly people, the chances of their immunity is weaker. So that should be the same model that we should adopt here, provided we are sincere about it. And I actually want
sincerity.
Yes, because I think that COVID, they have done a whole lot. The other day, they expressed intention to give 100 billion for the police and all that. That's excellent. But it's also important that they get involved in this process and not just making funds available, but integrating monitoring and evaluation processes that ensures that we can track how the vaccine comes in, how it is utilized, and there could be accountability at every phase of it.
And then we see get results to know who should be administered at the end of the day, because there are talks about reactions and some other limitations to all of these vaccines. And so if we are able to track, we know where and what to make adjustments. I guess that is what we're trying to say.
True.
But then again, you know how we are with data in Nigeria. That is another challenge for this kind of issues, because data is key and its management is also very key. And there are concerns as well that with all of the limitations that is set to come with, especially this Pfizer vaccine, should health workers be the ones to be administered first? That is, those are the front lines. If they have this complication, who then takes care of those who get infected?
What the complications or side effects that have been cited, when we look at it vis-a-vis the collateral damage that comes from COVID-19, this can be managed.
Right.
Fever and a few minor, they are not very fundamental compared to the fatalities that happen when you let COVID-19 have its run its full swing.
All
so
right.
it's also a exploratory initiative, because if you look at it in the last, most vaccines don't come out in less than 9 months as it happened now. But because everybody knows that this one has defied many solutions, so there could be further improvement by the inventor, those who invented it, and even the science community, that okay, this first phase may be having these limitations in terms of side effect. As it's been tested, more improvement will happen. But
right.
It's worse not to have a solution at all.
So what should Nigeria be doing now? Because in terms of gathering data ahead, receiving the vaccines, knowing that there are certain groups of people who shouldn't take the vaccine, perhaps if you're pregnant, according to those reports. So what should we be doing in preparation towards receiving the vaccines, that is towards next year? And also, there are also talks about the fact that there is a shelf life. The vaccine cannot stay in a certain temperature. It has to be in a particular temperature. So what should we be doing in preparation towards receiving these vaccines?
What I see about Nigeria is that when there's a political will or a sincerity of purpose to get things to work, we achieve it.
Right.
If the federal government or the private sector and social sector decide to work sincerely, they would be able to defeat this current menace. So, including having the critical entities like Nigeria Medical Association, all the professional bodies, incorporate them into the process of identifying, mapping where the vaccine should go. Look at which states have higher incidence of infection. You could see Kaduna, you could see Abuja, you could see Lagos, and some other areas where the incidence of the menace is high. So those areas may be given priority. Of course, the Nurses Association and all of that, they incorporate them, ensuring that, okay, have like a war room situation where you can get the data and monitor who and who has received, what stock do we have, how are those stocks being utilized. And the second question you asked about the power, preserving it.
Yeah.
We have a peculiar situation. So power is not stable here. But where there is genuine commitment by government and the private sector, and I still always make reference to Kakovic, led by CBN and other private entities. If they are sincere to say, okay, this thing is a common enemy, let's fight it together. We can go back to our old ways, but let's even deal with this. Because if this number starts getting to 3,000 per day, 5,000 per day, 10,000, of course, we don't even have enough facilities where people can be treated. We don't have enough health personnel who can handle it. So if we can use certain measures like, of course, all of us know that generator works in Nigeria. It's almost like our standby stuff. And we also can use solar. Solar can also preserve the shelf life. So those are tentative measures until we get to our Eldorado.
Eldorado, indeed. So let's quickly, for a purpose of reminding people what caution to take. They say prevention is better than cure. What the preventive measures, perhaps we need to remind people again. So
the very first and most important one is, this Christmas or this festive season, stay away from crowd.
Really?
Yes.
But you know how it is with Nigerians. We love parties.
Yes, I love parties, but I'd like to have more parties after 2020. I would like to have more in years, 10 decades to come. So make sure that you stay indoors if you don't have any cause to go out.
Right.
Have your nose mask, and we know that many do not wear their nose mask anymore. Always make sure that you are wearing your nose mask. 3, make sure that you wash your hands for 20 seconds and with soap. And maintain the social
distancing. Very important.
Most importantly, governments should deploy health monitors and inspectors to ensure compliance. All right,
Pascal Achunine of the Health Emergency Initiative, thank you so much for your time on the program.
Thank you for having me.